be presenting to you my project, measuring normal esophageal hiatus size through CT scans. The esophageal hiatus is a small opening in the diaphragm, which allows the esophagus to go through the diaphragm and connect to the stomach. And the size of this hiatus is very important, as having an abnormally large hiatus can cause serious complications. And to this day, there has been no study that accurately determines the size of a hiatus in normal physiological conditions. And it's important to know the normal so doctors can diagnose the abnormal. The purpose of this experiment is to determine the average hiatal surface area, or HSA, in normal men and women in different age groups. So previously, the HSA was determined either during surgery, under anesthesia, or through cadavers. But in these conditions, the muscles are very relaxed and the HSA will appear larger. I wrote a study about a novel method of using CT scans to determine the HSA, and I thought this was something I could try because, one, I had access to many CT scans through Temple's PAC systems with my connections from a radiologist who works at Temple, and two, this solves the problems that other HSA studies faced because I'd be able to measure the hiatus of a person under normal conditions. So to actually measure the HSA, I had to first learn the basics of radiology and multiplanar reconstruction. To find the hiatus, I had to first find the esophagus, and a dead giveaway for the esophagus is that it's the only structure that contains little black spots in the chest, and these black spots correlate to air that the patient has inhaled during surgery. So if I find these black spots and follow it down the body, I will eventually be led to the hiatus. This is a multiplanar view of the abdomen. There are three main planes used in radiology: the sagittal, coronal, and transverse plane. The different angles of these planes shows you different views of the same structure. In the program, there are lines that correspond to these planes. Think of these lines as slices through the body. You can rotate these lines any way you want, so you can see the hiatus, which lies on an oblique plane. And since the hiatus is located on a tilted angle, the slice has to cut at the right angle, so the whole hiatus is visible. After some manipulation, the transverse plane will look like this. And this is a pretty good example of a hiatus. The teardrop shape is very defined. And using the measuring tool in the program, I was able to find the surface area of this structure. I repeated this process 119 times with 61 males and 58 females in age groups 20 to 40, 40 to 60, and 60 and above. I first wanted to construct confidence intervals with my data. So using the formula with 95% confidence, the population mean for HSA for women is between 2.33 and 2.68 centimeters squared, and for the men it's between 2.70 and 3.07 centimeters. I also wanted to perform a two-way ANOVA test on my data. This was to determine if there is a statistical difference between the mean HSAs in men and women and different age groups, or if this difference is just from this sample. So this test is explained in further detail in my presentation, but in summary, the only variable that affects HSA is sex, with men having larger hiatuses than women. There was no difference between the mean HSAs of the younger or older groups. The only error that could have influenced my results was my method of convenience sampling. I had taken all the samples from one hospital, and them being in the hospital might suggest that they have some kind of ailment or condition that sets them apart from the normal population. So their means may not truly represent the population of normal men and women. Unfortunately, this was the data that I was constrained to, and this is an issue that every clinical study faces. If I were to continue this study, I would perform a post-hoc test on my data to determine which of the 6 groups' means were actually different from each other. I would also gather more data in the 20 to 40 age group since I was lacking in some data in that group. Thank you so much for listening to me, and I hope you have a great day.